Bundle prevention or reduction in the incidence of VAP. اختصار لإيش الVAP? Ventilation associated pneumonia can be accomplished by using in line with suction catheters. The use of endotracheal tube that allow for the removal of subglottis secretion has been shown to reduce VAP. Sinusitis is also associated with VAP, so that we have to treat sinusitis اللي هي التهاب الجيوب by appropriate using of antibiotics. The critical care nurse need to monitor for nasal secretion and ensure that devices such as nasotracheal or feeding tube are removed from the nose when these occur. Oral care is very essential and help to decrease the VAP because some organism secretion may move from the mouth to the lung, causing infection. Elevation the head of the bed 30 degrees and feeding the critically ill patient with a post-pyloric feeding tube have been shown to reduce microaspiration and VAP اللي هي الالتهاب الرئوي الذي يتصاحب مع وجود المريض على جهاز تنفس اصطناعي. Immobility caused by bed rest, sedation, or pharmacological paralysis has multi-system effect, so that frequent positioning is very important. Positioning prevent and reverse atelectasis and facilitate removal of secretion from the airway. The prone position help improve gas exchange and facilitate pulmonary drainage. Support pharmacological therapy, infection if needed, as antibiotic use to prevent or to treat infection when needed or based on the blood culture. Bronchodilator, mucolytic to keep the airway patent and reduce the inflammatory process. Surfactant drugs under study. Corticosteroid as anti-inflammatory drug, anti-inflammatory mediators, sedation, promote comfort, reducing respiratory effort, decreasing O2 demand. May we use propofol medication? The propofol has special consideration and will be discussed when we discuss the intracranial pressure lecture in the neurological system. Good nutritional support should be provided for the patient. Why? Because the mediators stimulate release of proteolytic enzyme that stimulate protein catabolism from skeletal muscle. In addition, the protein will leak or the protein leakage from the blood to the interstitial space, so that the diet should be balanced with calorie, protein, carbohydrate, fat intake, and calculated based on the metabolic needs. Enteral nutrition help to prevent infection, and when we said enteral عن طريق الامينو acid by IV infusion. Bundles also to prevent VAP, as we said, elevate the head of the bed 30 to 45. Weaning protocol as soon as possible. Deep vein thrombosis prophylaxis, peptic ulcer prophylaxis, and suction, and limit the suction 10 seconds when the catheter inserted in the endotracheal tube. Prevention of complication like VAP وحكينا عنها. Sepsis اللي هي septic infection. High level of PEEP may lead to volutrauma and paratrauma. Pneumothorax emphysema and chest tube is needed here. Immobility may lead to accumulation of secretion and result in pneumonia. Deep vein thrombosis may result from the immobility. Low dose of heparin is needed. Elastic stocking, external pneumatic compression, frequent mobilization help prevent the occurrence of deep vein thrombosis. Paratrauma is the physical damage to body tissues caused by the difference in the pressure between the air space inside or beside the body and surrounding the fluid, so that it's damage in the body tissues. Lung tissues. Body trauma هي damage to the lung caused by over distension by mechanical ventilator when there is an excessive tidal volume.